The starting point for a lot of these patients is utter misery. Their lives are out of control in terms of the symptoms that they're experiencing.
The fibromyalgia stopped me doing a lot of things. I've got a 3-year-old granddaughter and I know I can't look after her completely by myself. That hurts because it's like I want to be a proper nana and I can't, because sometimes this arm doesn't want to do what I want it to do. And it does, it affects you doing everything.
We're treating all sorts of conditions, and what would characterise them is that the cause is obviously not known. You have all sorts of conditions where the nervous system is misbehaving for reasons we don't know. Chronic fatigue's another one.
My body feels inflamed. It's like an inflammatory feeling, a burning sensation, and it's not just like in my elbow, my arm, it's everywhere. I'm constantly clicking joints and moving because if I don't move, I'd stiffen up.
Patients who have chronic pain lose their sense of agency because their lives are just completely dominated by feeling the pain that they experience.
Well, you have to go right back to the beginning, and I always take a full biography from them, because things can happen when you're growing which disturbs the connection between you and your body.
So the first time I came to Kairos, I met David, the doctor. He explained the process. He asked me what my problems were, and he said that my body was in a big shock from the trauma and the treatment that I'd had. And that really made me think, because I thought, well, that's right in a way, because my body is in a shock, and it's like a shock that won't go away.
And the thing that links everybody together, the thing which anthroposophic medicine helps us with, is to include the patient in the process.
Down the back, right down the legs.
With the Kairos clinic, it's more of a collaboration there. With Dr. David really listens to me, and he listens to how I've responded to the treatment that the therapists have provided. The therapists listen to me all the time as well. We're giving constant feedback, and they talk to me, which is a form of counselling, which I've really enjoyed as well.
My first class was with Suzanne, doing art therapy. And I can remember going in there again, not understanding how this was going to help, but just sitting there, talking through how I was feeling, and someone not realising that's what I'm doing, is talking through what is happening with me.
You need to have a team who is fully understanding and sympathetic with the patient, and you need to have the time to do it, and you need to have therapies which can actually bring about change.
So the patients we see generally haven't met this kind of approach before, this anthroposophic approach, but people who come to Kairos, most of them have tried a lot of other things, and they will usually say, well, I'll try anything once. It is not a problem to not have met eurythmy before. You don't need to buy into anything. As long as you find a way of practicing, then that is really what counts. And of course, it is not for everybody. Some people find it very odd, and then we can make an appointment for them to see the doctor, and one can change tack.
So if anyone I know is in long-term pain, definitely recommend people be referred for it.
By creating, movement therapies, art therapies, massage therapies, it just distracts the brain slightly away from what is become so fixated, and that then allows them to do things a little differently and try to focus less on the pain, more towards what they can do and what they enjoy to do. And then slowly but surely you can see an impact on the primary problem in their lives, which is the pain. My friends have noticed some change in me. They've noticed I'm a bit more forthcoming with talking or phoning. They've noticed I'm more confident. So I was doing things that helped me. What I have seen through engagement with Kairos is that they are able to transition away from that hopeless situation to get themselves back to a kind of level grounding whereby the future is no longer bleak, it's brighter, and all of a sudden you're someone that goes from needing everybody else's help to being able to help others around you. And I think that that's a huge transition point that I have personally witnessed.